Hello everybody. I'm making this video to try and inform people on the procedures done with laser for the eye vision. Um, I normally wear eyeglasses, and I wear them all the time. It's not just reading or nearsightedness or I'm required to wear them all the time. So this is for people who are wearing their glasses all the time. My prescription is a plus prescription, which means it's for farsightedness. Now with all the boards on the streets and in around the Greater Toronto area, we've got Lasik MD. That's the most sort of advertised company that does the procedure, the laser procedure, that is. For a few $100s, you could quote unquote fix your vision for good. But this hasn't been the case. It's been a month in the procedure, since the procedure, and my vision isn't much better. It isn't far off better. Part of the reason is there's risks involved with the procedure, which they kind of they don't point it out. They just tell you. They give you a bunch of affirmative comments. The technicians, the opticians there give you a bunch of like, yes, it's for you, the procedure definitely works, you'll have a regression rate, but they won't explain what the regression rate is. What does the regression rate mean? It's all just they'll tell you it's chances, but really it's the regression rate is what your eye vision will decrease by after the procedure. So yeah, you go through the procedure and you find that your vision is better off, if your glasses were off. If you're comparing your eye vision without the glasses, yes, it'll be better off than before. For each person is different. In my case, my left eye is a bit weaker, and because of dry eyes, I have to put drops every hour, even shorter intervals if I'm focusing or reading or something. It's been a tough month. It's been a nightmare, actually. Lots of ups and downs, and that is because the procedure in itself isn't the I've searched more into it. They don't tell you about many of the risks that are associated with the procedure. For farsightedness, when you do the procedure, you will get to basically trade off. What happens is a trade-off between nearsightedness and farsightedness. So if you're fixing farsightedness, excuse me, if you're fixing farsightedness, then you're doing a trade-off with your far vision. So basically now I see closer vision better than before, but my far distance vision is compromised, and that has to do with the cornea, the corneal shape and whatnot. But either way, the procedure is heavily marketed. It's just a few $100s, and you don't get to see the doctor, the ophthalmologist, until 5 minutes when you're in the procedure room just before the procedure, uh, which is to me is unacceptable. I've pressed to see the ophthalmologist many times, called the center many times. They don't seem to care at all. So I'm very disappointed with their service. For a small number of people, they could fix their vision for good, but for a lot of others, uh, they do not. They do not do good. They are just harming the eyesight of people. So I would say stay away from these guys. Don't risk your vision. They'll tell you, we can redo the procedure, with an enhancement plan. Really, would you risk your eyes again? Go look at the comments online. Go read online about it. The procedure involves removing the flap, and then the laser shoots at the eye to shape it according to a certain map of the cornea. The procedure is in explanation it's simple, but the complications that could occur are tremendous, and they will have a tremendous effect on your vision. Just opening the flap, if dust particles get in, it's equivalent to a camera lens that you have, with dust particles on it, and you take a picture. Same thing, your vision will be blurred. So I have blurry vision now, especially when I have dry eyes. So